Seeing your dog have a seizure, it can be incredibly distressing, but with about 3 out of every 4 epileptic dogs having at least one recognizable seizure trigger, identifying what could be causing, what could be triggering your dog to have a fit can be a really valuable tool to help you reduce their seizure frequency and severity in the future. And there are 5 main categories of seizure trigger that I'm going to talk about with you today. And the first seizure trigger is going to be due to hormones. If you have an intact female dog, then actually coming into heat can trigger not just seizures, but it can trigger cluster seizures, and cluster seizures are some of the more dangerous ones, definitely ones that we want to avoid. And actually the effect of coming on heat can last for 1 to 3 months when it comes to triggering seizures. Now, if instead you have an entire male dog, actually being around a female dog on heat can also trigger them to have a seizure. So this is one reason why it is a good idea to have your epileptic dog neutered and desexed. Now, the other one is because this is a genetic condition, or it can be genetic, so we don't want to pass on that epilepsy to any potential offspring. The second seizure trigger category is stress. Now, this is going to vary depending on how well socialized your dog was, what they enjoy doing, what actually freaks them out. But things like visiting the vet clinic, even going to the groomers, going to a boarding facility, even just a change in their life situation can really be stresses that can trigger seizures. It might be unfamiliar places, so they've always got their normal place that they go for a walk, for their exercise, the normal daycare, but going to an unfamiliar place for whatever reason can be detrimental to their seizure control. Just a change in daily routine, even altered sleep patterns can be enough to trigger seizures. And this, I would imagine, is going to be especially the case in anxious dogs who are going to be more likely to become stressed in these situations. Number 3 is almost the opposite of stress, and this is actually excitement. So this could be visitors coming to the home, playing with other dogs, even intensive exercise, anything that's really getting your dog kind of quite wound up. And I guess that's the same as stressful situations. They're getting wound up. Here it's with excitement though, so in a good way, and otherwise you would expect that to be a really good thing. But for our epileptic dogs, it may be that this is triggering your dog to have seizures. Fourth main seizure trigger is environmental. So this is what's going on in the world around them. 2 ones that have been recognized here: hot weather, it's going to be especially sudden hot weather, and also flickering lights. So that classic human epileptic trigger, if you like. Any flickering lights may also trigger for your dog. And the 5th group of seizure triggers is going to be health related. So here I'm thinking illness, if they're in pain, if you're forgetting any medication. Now this is certainly important with something like phenobarbital, where actually if you suddenly stop medication, so you forget to give a dose or 2, that can definitely trigger seizures. Even actually some medication can precipitate seizures in epileptic dogs, and this is a big one. So thinking here, things like the isoxazoline class of parasite control. So we've got Bravecto, Simparica, NexGard. Now they don't really trigger seizures in otherwise healthy animals, but if your dog is epileptic, if they've got a history of seizures, then we shouldn't be giving these drugs to those individuals. And in the studies that have been done that identified these as the most common triggers of seizures that we were recognizing and being able to identify, another important point was that a dog may actually have more than one trigger. They may also experience a mix of triggered and non-triggered seizures. In fact, they are going to have a mix. Some dogs may be triggered more often than not. Others, they may just have completely random seizures or seeming random seizures, and we're only able to identify a trigger in a much smaller proportion. Also, the trigger doesn't always result in an immediate seizure. For some dogs, it can be actually while that stimulation has happened. So while that anxiety, for example, may be that actually it's delayed. It's within 24 hours of experiencing that trigger. For some, it's actually quite a bit of a bigger difference. It can be within 2 days of experiencing that trigger to then having a seizure, and that can be really difficult to identify. But that's one really important reason why actually keeping a seizure diary is important if you do have an epileptic dog. So noting down not just what you were doing at the time, but maybe looking back the previous 24 or even 48 hours to see, as your dog potentially has more seizures? Are there any commonalities which will allow you to ideally avoid those triggers in the first place? Or if they do happen, to maybe take steps to talk to your vet about giving some preemptive medication to stop them actually having a seizure that they otherwise would have. But while identifying a seizure trigger is really important, if your dog has epilepsy, then these 9 facts on screen now are vital for you to know so you can better understand and control their seizures in the long term. So tap on that video, I'll see you there. But until then, I'm veterinarian Dr. Alex. This is Our Pets Health, because they're family.